is there also a failure of medicine? And I have to say there is. And I've encountered this more and more recently, unfortunately. And it's really hard to think about it because this is what I do as a job. But there really are shortcomings of my job and ability to get people better, which is my job basically, right? Recently had a lady who couldn't eat. I mean, this is not a fake cannot eat. She's already had tubes feeding her. She's on IV nutrition. This is a real cannot eat. They've tried everything, done extensive investigations, seeing what's wrong with her GI tract, and basically found nothing. I knew what's wrong. I mean, the prior doctor may have not said it, but we all know what's wrong. It's psychological. There's a lot of stress in life. She can't handle it well, and thus she doesn't eat. She can't handle the food. It's not that her body can't handle it, but her mind and her body working together cannot handle it. If you could turn off her brain, she'll eat perfectly, but you cannot. The food has to sort of go down. So what's the solution? Well, the solution is to fix her life. That's not something I've trained to do and not something I'm good at, right? I've tried to be empathetic, and that does help. I talked to her, listened, and she felt better and she ate more, but she's going to relapse, right? Psychiatry weighed in. They only have medication to offer, which might be a bandage, but is also not a solution. You think about this all the time, and this purpose of life, or how your external life is, as an external to the hospital. I call it external because I only work in a hospital. I don't see people outside. And I think about the people who often are failed by the system, if you will. Failed by medicine. And that is alcoholics. I feel almost we should ask people coming in, do you want to quit drinking? If not, what's the point of detoxing you, right? It makes you feel uncomfortable. There's some risk. We load you up with these medications that aren't good for you, like benzos. And yeah, if you go back to drinking, that's doesn't matter, right? Or the alcoholics who come in with liver damage. You're like, well, are you going to quit drinking? If not, well, I mean, this is just putting a bandage on and get you better. You can go back drinking. You're going to die on one of these times, right? One time they can't fix you. There's no point. But stupid us, we don't talk about that. Rather, we can't put consequences on people. But I think one thing really is alcoholics many times lack purpose. I find a lot of them are intelligent people, but they have issues in life and they don't know what to do with it, so they just drink. Same with other drugs, right? Except that alcoholics are special, because many times they're intelligent people. I don't know if I can make that statement about other drug users. The problem is, how do you give them a sense of purpose? Like, you really think a doctor is the one to give someone a sense of purpose? Maybe a pastor, priest, chaplain, religious type, or a motivational speaker, blah, blah, blah. But a doctor? Really? I mean, that's where we fall short, right? I mean, surgery shouldn't happen, I say, for other reasons. Medicine is better, right? Medicine is internal medicine, medication, preventive care, blah, all that stuff, right? Lifestyle changes. But this is something different, a purpose. I always find this interesting, this concept of depression, because really the ones of us who are insane are the ones who are not depressed, right? If you look at the world around you, all the wars, crimes, hatred going around, the world is a horrible place. Why should you be happy living in this world? It really is those of us who are blissfully ignorant, who somehow manage to ignore all this stuff and live our lives sort of happily, that are wrong, that have weird, messed up brains. The people who are depressed, the world is depressing. You're right. You're completely on point. But the thing is, how do you give people a purpose? How do you tell them to ignore what's going on? Focus on yourself. Be blissfully ignorant. How do you do all this stuff? And again, that's not what I do. But that's an essential part of my job if I want to make patients better, right? I have one guy who's here for infection. We're treating that. We'll probably figure out where it is soon enough. But he's going down the drain because of other reasons, right? I mean, he's hundreds of pounds overweight. His diabetes is going to take over his life. His infection is in his foot going to get worse. He's probably lose it someday. Giving him insulin is not the fix. Giving him blood pressure medication is not his fix. Giving him antibiotics to treat the current infection is not the fix. These are all short-term bandages, if you will. The fix obviously is losing weight. But how do you do that? That's something I can't do. That's something most of my colleagues who work in a clinic cannot do. But that's more important, right? Fixing the underlying issue, right? If you go and you're like, oh, I have pain, the doctor's like, oh, let me give you some morphine. Yeah, I'm not trying to die here. I'm trying to get better and live life. That doesn't fix the fact that I have a fracture in my foot, right? Okay, right? But that's what we're doing to patients in the hospital. We're fixing the superficial issues, not the deep underlying issues. You think the man doesn't understand he's overweight? Of course he does. Do you think he doesn't want to lose weight? Of course he does. But how do I help as a doctor? I don't know, right? And that's where medicine fails. Fixing underlying issues, giving people purpose, lifestyle changes, which all goes back to the same thing, your heart. The figurative heart, which none of us know how to fix.